So I'm Michelle Call. I'm the Executive Director of GALA. We serve the LGBTQ plus community in SLO. We do advocacy. We have support groups, resources, social events, all that kind of thing. And it's very important that we do these things, which are protective factors for the mental health of our constituents. And acceptance of sexual orientation and gender identity is really an important part of preserving people's mental health. Which is why we recently did a body positivity fashion show with our youth group that they're still talking about, and some of them said that they actually felt good about their body for the first time in many years. So that kind of thing is really important. So we're going to talk about the mental health of LGBTQ plus in SLO County specifically. There have been 3 surveys recently that have given us a great deal of information. Dr. J. Betta Garcia at Cal Poly has done the Q Cares survey. You may have heard about it. They surveyed the whole county for many months. I can't give you the results of that survey just yet because they got a very generous innovation grant, and they have to report to the county first, SLO Behavioral Health. They're very grateful to Frank Warren for that. But those results do mirror pretty much what the California Healthy Kids survey said and what the California LGBTQ Department of Health and Human Services survey said, which was a survey of all of California. The California Healthy Kids survey is done in the state, 7th, 9th, and 11th grade, and we have had the numbers broken out for us for SLO County. So we have a really good picture of what our own county looks like. So the numbers we have are from 2013, 2015, and 2017. And in 2015, the figures, you may remember that for Pride a couple of years ago, we took out a big ad in the New Times that said 48% of transgender youth in San Luis Obispo County have seriously considered suicide in the last 12 months. We thought that was a bad number. The 2017 number is 57.9%. 48%, so 68.7% have felt so sad or hopeless in the last 12 months that for 2 weeks or more, they haven't been able to do any of their usual activities. So these statistics are kind of grim, but we're really working on it. So I want to tell you about Out for Mental Health. So Out for Mental Health is something that the California Department of LGBTQ Health and Human Services has set up in only 5 counties in California. We happen to be one. It's a 3-year program, and we formed a coalition of lots of local nonprofit groups in town. Raise your hand if you are part of the Out for Mental Health Task Force here, or if your nonprofit organization is. So we have lots of organizations: CAPSLO, Cal Poly, CASA, Central Coast Coalition for Inclusive Schools, Vet Services, the Suicide Prevention Council, the Police and Community Together Task Force. We're all working together to really implement these new policy goals. We're advocating for policy change in the county. The first is to provide training for everybody in LGBTQ plus 101, particularly transgender 101, for people who provide services in the county, especially services that are provided through the county. And the other part is to become a resource clearinghouse so that we can look at forms and best practices at a doctor's office or at a mental health clinic so that people are treated properly the moment that they walk in the door. So that's really what Out for Mental Health is doing, and if you want more information about that, definitely see me. The other part that's happening is a really exciting innovation project that Dr. Betta Garcia, again, is bringing through Cal Poly. And so do you know how many doctors in this county will prescribe hormones for transition? Anyone have a guess? There's one doctor. And when it comes to mental health services, there are a few affirming mental health providers, but nowhere near enough, not enough for the whole county. So this innovation project through SLO Behavioral Health, in the first year aims to train 25 mental health providers in LGBTQ plus competency, and it's going to be an intensive course where there'll be several in-person full-day sessions and there'll be meetings in between. And they're going to train people all over the county, so it'll be spread out. It'll be people that take different kinds of insurance. It'll be some people that work for county services and some people that work privately. So they're going to do 25 in the first year and then 25 in the second year after they tweak the program and figure out what worked and what didn't work. So at the end of this project, we'll have 50 specifically trained LGBTQ plus mental health providers in San Luis Obispo County. Yeah. So I just want to conclude by saying that, of course, pride is a huge preventative factor because people get to be around people whose sexual orientation and gender identity matches with their own. So we really hope that you will come out to Pride, show your support for the LGBTQ+ community, and see me if you have any questions.